Welcome back. We hope you enjoyed the interactive chat session with the National Center for Missing and Exploited Children. As a reminder, if you can see us but can't hear us, turn up your computer speakers or access the help desk and they can help you out. My name is Melissa CORREIA. I work for the Capacity Building Center for States, where I lead work to build data capacity for child welfare agencies. And we're going to kick off a presentation entitled Collecting, Using, and Sharing Data to Inform Prevention and Intervention Strategies. The Preventing Sex Trafficking and Strengthening Families Act, or PL 113183, includes a number of requirements for new or improved data collection. It's also instructive about what agencies must do with the data they collect. Improved documentation and reporting is intended to help inform the national response and provide appropriate services to achieve better outcomes. Specifically, agencies need to collect and report the number of children in foster care who are identified as sex trafficking victims either before or while they were in care, the number of children and youth at risk of sex trafficking, including youth who have run away or are missing from care. Youth who run away from foster care are particularly vulnerable to sex trafficking and its dangerous mental health and physical health consequences. To better address the needs of this high-risk population, the legislation requires child welfare agencies to identify youth missing from care, determine the factors that contributed to the youth running away from care, determine children's experiences while they were absent from care, including whether the child was a victim of sex trafficking, and report related information as required. So states must report missing children or youth in less than 24 hours to law enforcement for entry into the National Crime Information Center, NCIC, database and to the National Center for Missing and Exploited Children. Administrative data, it's data that agencies collect routinely as part of their everyday operations, are an important and often underutilized source of data in our efforts to improve access and quality of services, and ultimately to improve outcomes for children, youth, and families that our systems are designed to protect. For example, the data might indicate a need for products or services aimed at different subpopulations, or within particular districts, counties, or areas within a state, where youth seem to be running away at higher rates. Conversely, the data might also indicate that certain offices document very few youth who've run away from care, and that could raise important questions about data quality and the accuracy and completeness of data collection. We know that child welfare agencies vary in their ability to collect and use this kind of data. Some agencies will need to modify their existing data collection systems to meet the requirements of PL 113183, while other states have been collecting this type of information and using it effectively for years. We're pleased to have representatives here from 3 state child welfare agencies who have been focusing on this issue for quite some time. Our panelists will speak to how their states have used data to identify and explore the problem and inform policy and planning. Perhaps most importantly, the panelists will discuss how access to these data has improved prevention and intervention strategies. At the same time, we know that state child welfare agencies are not the only service providers who interact with victims of human trafficking. I'm happy to have LATECIA Ingram here with me today. And LATECIA is the Research and Data Coordinator for the Office on Trafficking in Persons, or OTIP, where she provides public health subject matter expertise and oversight of data collection, evaluation, and research activities. OTIP is responsible for the development of anti-trafficking strategies, policies and programs to prevent human trafficking, build health and human service capacity to respond to human trafficking, increase victim identification and access to services, and strengthen the health and well-being outcomes of survivors of human trafficking. OTIP collaborates with federal partners and other government and non-government stakeholders to raise public awareness, to identify research priorities for ACF's anti-trafficking work, and to make policy recommendations to enhance anti-trafficking responses. Now, LATECIA's public health career spans more than 25 years, serving interest in nonprofit organization capacity building, rural health, minority populations, and health disparities at the state, national, and local levels. She holds a BA in psychology from Spelman College and a Master of Science in Public Health Promotion and Education from the University of South Carolina, Columbia. LATECIA is going to tell us about OTIP's approach, including the Human Trafficking Data Collection Project. LATECIA?
Thanks so much, Melissa. Let me begin by setting the context for the Human Trafficking Data Collection Project. Data collection is one of 3 key areas of focus in OTIP, along with performance evaluation and research. Our immediate priority focus is to establish uniform data collection across multiple stakeholders so that we can benchmark performance, evaluate resource needs, and conduct research on effectiveness of interventions. HHS is limited in its ability to measure, monitor, and evaluate progress on efforts to prevent, protect, assist, and serve victims. And without data collection, we don't know who's at risk, the victim's needs, their unmet needs, or the cost of care. Among federal agencies with human trafficking missions, there are 39 different definitions. We know that there's a lack of data for a lack of funding, severe lack of funding for data collection. And lessons learned from domestic violence highlight the need for us to prioritize the number of victims served rather than prevalence estimates. Our approach is to view human trafficking from a public health lens so that we're able to broaden the way in which the issue is addressed. For example, expanding the list of those who need to be involved in human trafficking and anti-trafficking data efforts. Informing interventions that reduce the risk of vulnerable populations. Highlighting the social and economic dynamics that enable human trafficking in the first place. And by treating human trafficking as a public health disease, will not only allow law enforcement and social services providers to treat the symptoms more effectively with targeted interventions, but also will aid in the analysis of cultural norms and structures that need to be changed in order to eradicate human trafficking. This past spring, OTIP and the Office of Women's Health convened 2 working groups representing 3 agencies across the Department of Health and Human Services, 13 programs within ACF, and 80 non-governmental organizations, state and local agencies, and researchers. Over a 10-week period, we identified a core set of 30 key data fields that will be used to help us better understand victim demographics, unmet needs, and cost of care. We are submitting the data fields now for clearance and expect them to be available for public comment within the next few weeks. And at the same time, OTIP will begin a series of pilot processes that will begin to uncover the needs, technical assistance training, as well as systems development efforts so that we can inform information sharing practices and coordination challenges. We also know that technology will play a huge role in standardizing data collection, ensuring data collection is quality and facilitating information sharing. It will also allow us to manage privacy, security, confidentiality, and other concerns with personally identifiable information. In states where data coordination efforts are already evolving, key partners like Children and Family Services are not at the table. And we want to avoid missed opportunities for coordination, capacity building, and collaboration. We know that some of you have already taken the first steps in establishing partnerships with organizations such as rural health clinics and health centers and HIV/AIDS clinics, mental health substance abuse clinics, public health departments, and anti-trafficking organizations. These partnerships are the first step in defining the unique HHS role and mobilizing resources to assist victims. Now, beyond the partnerships, data sharing agreements will be critical to ensuring data standardization across the field, and also as well as engaging law enforcement and criminal justice perspectives. OTIP's data collection and reporting plan intends to support child welfare and other HHS entities to be at the table. And overall, we have a unique contribution to the field and a critical role in transforming victims to becoming resilient and self-sufficient. You are the catalyst and the glue to bridging public health, healthcare, law enforcement, and criminal justice stakeholders in uniform data collection. Melissa?
Thank you so much, LATECIA. When I listened to you talk, I heard common data definitions for data collection and also partnerships. And I think those are common themes that we'll hear throughout the panel from the rest of our panelists. But before we dive into the panel, we wanted to have a little interactive poll to get to know our audience a little bit better. So please look at the polling questions on your computer screen. The question is, where are you now with data collection, analysis, and reporting and dissemination related to children and youth who have run away and those who are at risk of or victims of sex trafficking? Would you say that your agency is A, developing, B, progressing, C, well-established, or D, strong and sustainable? And I'll go over those definitions. For developing states, we're really thinking of states who are just getting started. You're looking and reviewing the data collection requirements of this legislation and seeing whether you collect all the information that you need, and you're evaluating your data quality. For progressing, we would think about states that have most of the fields that are needed, and processes are in place to collect those data, and most of the requirements are met, but assessing data quality is still taking place, and strengthening those processes and use of the data would be an example of states that are progressing in this work. For well-established states, we were thinking more of states who have a well-established process for monitoring and using data related to youth who are absent or missing from care. But there are some remaining challenges, connecting data to practice, which is always a challenge, and to policy and planning decisions. Or strong and sustainable, the final choice. And those would be states that really have a strong history of using these data. They have strong data quality standards and reporting processes. Also, leadership and staff at all levels have access to the data and are using it routinely to improve their processes, their policies, their planning and decision making. Ultimately, the data support the field and service delivery. So it looks like some polling responses are coming in. And we have, at the current time, we have 60% of participants in this session saying that their states are developing. They're just developing their data capacity. 19% find themselves progressing. 5% think they are well established. And none of our respondents have indicated that they feel they have a really strong and sustainable system. And I know that that rings true for me in my experience. I wonder if everyone else nodding, you think that's what we expected, I think, to see. And it's really important, I think, for us to know that while our panelists have a great deal of experience and have been doing this work, it didn't happen overnight, right? So I'm really excited to hear from our panelists and hear more about their work. So thank you so much for voting. That was really, really informative. Our first panelist is Sue. And Sue ABOUL-HOSN joined the Florida Department of Children and Families in 2000. And in 2003, she was qualified as an expert witness in child risk assessment. For the past 13 years, she's been working at the Department of Children and Families as a missing child specialist, criminal justice coordinator, and more recently as the regional human trafficking coordinator. She's assisted in over 300 human trafficking investigations that were received by the Department of Children and Families Abuse Hotline, and has conducted over 100 missing children and human trafficking trainings for the field. Once the Department of Children and Families privatized their foster care services in 2004, Sue was instrumental in assisting the newly created community-based care agencies in Central Florida develop and implement their missing child protocols. Sue holds several certifications and has won numerous prestigious awards for her steadfast dedication and perseverance to stop crimes against children. Sue?
Thank you, Melissa. I'm honored to be here. I want to start off by talking about the history with the Department of Children and Families in tracking missing children. In 2001, we had a missing child go from care, a very young missing child go from care. And we learned from that we were not tracking our missing children. We did not know where all our kids in care were. And so we really revamped the way we did things. We created a missing child tracking system. It was a separate system. It was a web-based system that when a child went missing, a caseworker or an investigator could go in and fill out the report. But that whole form was created in collaboration with law enforcement and with the National Center Missing Children. that form actually gets completed. It gets sent up to a statewide specialized person who approves the form, who sends it to our Florida Department of Law Enforcement, who then, just with the click of a button, submits it to the National Center. And that was from 2002. We have progress since then. From that, we currently have our SACWIS system called FISFIN, which is Florida Safe Family First. I say the acronym so much, I forget what it stands for, but Florida Safe Family Network. And we created that in 2007, and thank goodness that we were able to put that missing child reporting system into our FISFIN. So we're able to pull the reports from that system, and it has a great business objects. It's called reporting system, and there's the ability to do ad hoc reports. So when you want to do specialized reports with certain characteristics, you can do that there. In 2009, the department added the human trafficking maltreatment to the hotline, so that also gave us additional reporting capabilities to connect with the missing child. And we also added, in 2014, we broke that human trafficking maltreatment to CSAC and to labor trafficking, because we learned quickly that when we're trying to pull data, when we're pulling just human trafficking, we don't know which reports are for sex trafficking and which reports were for labor trafficking without actually reading the reports. And then in 2013, with the Safe Harbor Act of 2012, we added a CSAC alert for kids in care in that whole same FISFIN system. So with all of those alerts and capabilities, we've come up with some great reports. So to get into the missing child report, it is now inside our FISFIN system. The caseworker or the CPI fills it out, and it goes to a designated person in the field in the area where that caseworker is. And she's an approver, she or he is an approver, and they send that form up to the statewide approver who sits in Tallahassee at the Florida Department of Law Enforcement. Even though it's a department employee, they are stationed there at the missing child clearinghouse with the Florida Department of Law Enforcement. That person has a lot of ability and runs daily data, daily reports. The first thing that that person does when she sees the report, and it's a she right now, sometimes it's a he, but it's a she approves that report after she runs that child's name into the NCIC system to make sure that child was reported missing to law enforcement. Because a lot of times we know that even though they get reported to law enforcement, they're no longer in the system, or they're never entered, or whatever the the issue could be. So there's a check and balance right there. And she also sends that report, and she also makes sure that the child has a picture, and also makes sure the child has fingerprints. She goes ahead and submits that report to the Florida Department of Law Enforcement, who also opens up a report. They have analysts there that also look for our kids, and they submit it to the National Center. So it's just all electronic. There's no phone calling or paper trailing with that. Again, caseworkers are trained on what to do. They know to call the National Center for follow-up, and the National Center will send a release also for the photos and the flyers. So that's how that goes. The actual missing child report is 5 pages inside the system, and the first page has a lot of great information on it. It has the child's information, but it also wants to know if the child has tattoos, has the child been involved in prostitution, is the child involved in gangs. So all of those are check marks, so we're able also to pull information and data later from all that information. It has a law enforcement agency in there. It has a narrative of what happened, why the child went missing. And there's also a recovery aspect to that. So when the child is located, everything is done again in reverse, where you put in a narrative where that child's located, so you also have the information of addresses, areas, etc. It also has to go through the approval process. So again, that person who sits up in Tallahassee makes sure that child is now out of FCIC and NCIC to make sure the report is closed properly. So the person who, our statewide missing child specialist is the title for the person up in Tallahassee, currently is Kristen. She runs daily reports. So she will send out to the fields and to all the administrators how many kids are missing every day, how many kids are currently in, if there's any issues. So if there's children out of FCIC, but we currently have an open missing child report in our system, or if there's a missing child report in our system, but there's not an open FCIC, NCIC report, so that's an issue too. Was that child missing or not missing? Why are they not reported? If the child has no pictures to be submitted up to the National Center, or if we have no pictures, it's on the report. If the child has no fingerprints, that's on the report also. So all that data is right there in front of you. Also, if the child has checkbox of involved in prostitution, That's also a separate column of her reports. Kids who are missing today who have that checkbox mix. So that's also a list that you will see every day. So there's several reports that she sends out, which are really useful to the field. And I think it keeps everyone accountable and everyone looking at it and making sure that all the issues are resolved in a timely manner. So I think it's really good. She also does, not daily, I think it's weekly now, a high-risk report. So victims that are thought to be at high risk. So that report is actually something that, it was an ad hoc report that was made a few years back. So if the kid is a habitual runner, that kid doesn't have to be currently missing. They could be currently missing, but that report is for all kids who's had multiple runs. I think they have a cutoff number of 8 or more runs. Also in that report would be, is there any history of sexual abuse allegations, any history of sexual abuse allegations verified, any history of human trafficking reports, CSAC or labor, verified or not verified. So it has many of the indicators that we see among our victims of human trafficking. Now, the people on that list don't have to have every one of those indicators, but if they have any of those, we know that they're at high risk. And so that list is sent out too. So case management also knows, can see that from one visual looking at it. So I think that's really important to have that statewide person. In addition, the local person. So there's several areas in the state, obviously, we call them regions, and we have different case management agencies, and everyone has a missing child specialist. So the case manager is sending it to their missing child specialist locally, and that missing child specialist sends it to the statewide one. That local missing child specialist is also a very important, I think, position that we learn, because they're the ones who know how to work with law enforcement. They start to know all the players who are involved. They have the connections. They know who to call when there's an issue, when there's not an issue, if law enforcement won't take a report, et cetera. They're the connect there. And they're also the ones to make sure, because we have a protocol that when a child is located, they have to do a debriefing within 24 hours. The case manager does, the primary case manager does. So also that information, that local missing child specialist is looking at all that information and looking for patterns as well in their areas and what to do. And maybe certain residential group homes have more runs than they should. You know, what's going on there? You know, we've had meetings before where we've gone out and to find out what's going on. And we'll bring in law enforcement, we'll bring in the staff from the group home and the missing child specialists and you know, whoever is important to be there. And we'll discuss everyone's protocol, because law enforcement has their own protocol. They're not happy to show up at a home every night, you know, and back and forth 2 or 3 times a night sometimes because of the habitual runners and locating someone and bringing them back. So they want to resolve the issues too. So when you know what's going on by looking at data, then you know, you might come up with some solutions. Maybe they need to change some of the rules. Maybe there needs to be more normalcy, or maybe, you know, maybe they're just going down to the corner store to smoke. I mean, you know, you need to figure out what's going on and why they're running, which is in our reports, you know, in the debriefing forms too, what made them run, what initiated the run. So if you have all that information, you can help resolve things. I know one very successful group home resolution we came up with, law enforcement agreed and decided they wanted to go out there every day afternoon just to sit down and chat with the kids. Some of them would just go out and hang out there in the cafeteria and type up their reports, you know, from being on the road. So, you know, the person in charge in law enforcement, the lieutenant, wanted to make sure his road officers were stopping in on a regular basis. So, you know, kids would get more familiar with them and feel friendly, not feel threatened by them, and, you know, things like that. So that's some things that we've learned from the data. We also know that entering the missing child report promptly and very timely helps, you know, find the child faster. I mean, if you report the child missing to law enforcement timely, do your report timely, get all the right players involved, and everyone's looking for the child, the more people that's looking for the child, the faster you will locate that child. We average, you know, 3 days. Most of the kids are located within 3 days. Some are longer, but 80%, 75% to 80% are within 3 days.
LATECIA responds.
Well, thank you, Sue. That is an amazing example of how technology informs processes and products, and the rapid data reporting that helps move the needle forward and working strategically across the state as well as the local area. Let's see if we have any questions from the audience. There is a question. It says the polling question referenced data. To our knowledge, technology guidance has not yet been issued by the feds on how to prepare a state system to report human trafficking data at a federal level or into NCANs. Is that incorrect?
Melissa responds.
I believe that's correct. But we will also follow up and get some more information out to you to address that question in a little bit more detail, I think.
Yeah, I think the key piece is that as we're working towards this, piloting within the systems, the state systems, is really the work that's in front of us. The state of fields that we've identified have to be piloted for feasibility, but we also need to see what the landscape is and what the barriers and challenges are moving forward. There's a second question. How long does a child need to be missing before reporting to NCMEC?
Stacy Sloan, Illinois Department of Children and Family Services.
There is no requirement. Children should be reported missing to NCMEC as soon as you know they're not where they should be and they're missing, just like you would with your own child. You wouldn't wait to report your own child missing. We're not going to wait to report our children missing.
That's wonderful. Thank you very much. Well, our next panelist is CARON of the state of Rhode Island. Colleen is an epidemiologist who received her PhD in public health. During the past 10 years, she focused her work in child welfare, behavioral health, and juvenile justice. Colleen works at the Rhode Island Department of Children, Youth, and Family Services, overseeing the Data and Evaluation Unit, and holds a clinical research appointment at Brown University School of Public Health's Epidemiology Department, where she co-leads graduate courses in biostatistics. At DCYF, she and her team engage in evaluation and research projects using data and statistical analysis to evaluate child, family, and program and system outcomes and support the department and community stakeholders in using this information to inform practice, programs, and systems initiatives and to manage performance. Colleen?
All right, thank you. And it's a pleasure to be here with this wonderful panel. I'm going to talk a little bit today about how the Data Research and Evaluation Unit applies a public health framework to program planning and evaluation, and even program planning and evaluation in response to legislation that we're talking about today. So the two public health frameworks that we typically use are interrelated. One is the primary, secondary, and tertiary prevention framework that you may be familiar with, and the other is an ecological model. So when we think about primary, secondary, and tertiary prevention framework, primary prevention is typically information that is used to increase awareness or knowledge about an event. And secondary prevention is typically used to design interventions at those subpopulations that are at elevated risk for an event. And in this situation, those subpopulations that are at elevated risk for either being a victim of human sex trafficking or absent from care, because we know that being absent from care can predict being a victim of human sex trafficking. And then the tertiary prevention are those program interventions aimed at youth who have already experienced the event. So those youth those subpopulations who have already been a victim of human sex trafficking or have already been absent from care. And when we're talking about subpopulations, this is where it really kind of connects with that ecological model. Because we're not only talking about, and with the ecological model, the kind of those embedded concentric circles. So when we're talking about subpopulations, we're not only talking about that inner concentric circle of the youth, we're also talking maybe at some of the outer concentric circles, such as the community. So there may be some subpopulations of providers just by the nature of them delivering service to more high needs youth who will have a higher prevalence of youth in their caring, who they care for, that are victims of sex trafficking, or may have a higher prevalence of youth who are elevated risk. So we're talking also about subpopulations also at that kind of community level within that ecological model. So really to kind of talk about some more now, two concrete examples of how we analyze and use data within those two public health frameworks. One was to inform, and the other was to is to evaluate the interventions once those interventions have been implemented. So when we're thinking about informing, we met with our program manager, who is the head of our specialty projects unit, who's overseeing this area. And we developed a logic model with interventions and outcomes. But one of the ways we wanted to use and analyze the data was to inform for programmatic reasons, so that we could really identify those subpopulations that are at risk for being a victim of human sex trafficking and those that have actually experienced it. Because those who are at risk for may need very different services tailored to them to mitigate that risk compared to, and those would be the secondary prevention, compared to those who are in the tertiary prevention, meaning they've already experienced it. So they may need more tailored interventions to address some of their issues, such as not only mitigating risk for repeat, but maybe also coping with some of the trauma that's being associated with being a victim. So again, it's getting at that kind of subpopulation of looking at the secondary prevention and tertiary prevention to know that your interventions may need to be different, so you can really have the most effective outcomes for those youth. Another area when we were talking with our program manager was they wanted to implement screening, because although we may have had a very robust data for those youth who are absent from care, which we used to, in our predictive analysis, to look at those who would maybe be at most at risk, was to implement screenings. And so another way was to look at it in terms of, for those who maybe are in that secondary prevention, you might want to have practices or policies where their screening may be slightly different from those who are in the tertiary or who have no risk, right? So you don't want to over-screen youth and burden them even more if they're not necessarily at that high risk. Another example that we had was and how we used the data analysis to inform was our program manager also wanted to begin training for our providers. So now we're looking at that kind of outer concentric circle of the ecological model and saying how we may implement the training for these providers. And so there may be just a very standard training that goes out that's delivered to all providers, but there may be those subpopulations of providers who have youth who are at higher risk or have a higher prevalence of being human sex trafficking, and we may want to overlay some additional training for them so that we can provide them with the tools and the support and the skills that in turn can really optimize the outcome of those youth. So those are kind of just a few examples of how we analyze the data to inform. In terms of evaluation, we also plan to evaluate the data to look at which interventions may have been more effective with which subpopulations. So are the interventions aimed at the secondary prevention seeming to be more effective than those at the tertiary prevention? And maybe we need to make some changes and modifications for those interventions that are targeting that for tertiary prevention. The other way we like to look at it too is when we're evaluating for the impact, are there kind of summative impacts across the different levels of intervention? Again, thinking of that ecological model. So when we're implementing the planning, the training at the community level, and when we're implementing the screening or the behavioral interventions, are we seeing a summative effect of all of those interventions, or are we seeing any interaction effects? And the reason why that is important too is because we all have a lack of resources. So if we know which ones are a little bit more effective on which levels, we may say we might want to start here and then roll out more as we move along. So we really can kind of tailor our resources to really get the best outcomes for our efforts. You know, but this is not an exact science. So we know what we call in public health, we call it ecological fallacy or a false positive, meaning that not every youth who has those, has the risk factors may ultimately lead to becoming a victim of sex trafficking. So that's where we really feel where the kind of the case planning and those interventions of the treatment plans can really buffer when there may be a youth who, although may have a risk factor, they may not ultimately then become a victim of human sex trafficking. And the other thing when we work with our interventions and looking at kind of what factors put a youth at risk, we like to really focus on those ones that are modifiable, right? So that you have, let's say, the behaviors that place maybe the youth at risk, or their perceptions that place them at risk. Because we're not going to change the fact that maybe in our state that She's a female and she's 17 years old today, right? So, but we can have interventions that are being targeted toward those, what we call those modifiable risk factors, things that you can change. We try to keep those two caveats kind of there, that, you know, you do have maybe sometimes where a false positive, and also where you want to really focus on the modifiable risk factors. So where we are right now is we're still in the kind of early stages of informing. We've analyzed the data. We've enhanced our dashboard. So at any given moment, anyone can see who is absent from care, how long they've been absent from care, how many times they've been absent from care. And so that's kind of on the day-to-day level. And then we can always modify and keep analyzing the data to refine our predictions for that.
Excellent.
Melissa responds.
Thank you so much, Colleen. It's great to hear the different perspectives. And so now we're going to move to our final panelist, and that's Stacy Sloan from the state of Illinois. Stacy has a long history of advocating for exploited children. She began her career at the Illinois Department of Child and Family Services in 1989, working directly with families in their homes and communities. As a member of the DCFS Child Location and Support Unit, and as the DCFS liaison to the National Center for Missing and Exploited Children, Stacy supported efforts to recover youth missing from care, especially victims of human trafficking, for more than 12 years. Stacy is the DCFS liaison to the Federal Bureau of Investigations, and in 2012 she received a commendation from the FBI for her assistance with human trafficking cases. As the DCFS statewide human trafficking program manager, Stacy's developed and administered the department's response to human trafficking since 2012. And Stacy has a Bachelor and Master's of Social Work from the University of Illinois. Stacy?
Thank you, and thank you for having me here today. I really appreciate this opportunity to talk to everyone out there. Our response at DCFS really began in 2003 when we were tasked with coming up with a response to youth missing from care. At that time, we had about 1,000 kids missing from care, and so I helped someone bring up a response which included the Child Location Support Unit, which remains today. It's called the Child Intake and Recovery Unit now. So we require that children missing from care are reported to law enforcement and to DCFS immediately. There's no time limit on that, no waiting. And also part of that response is reporting children missing from care to the National Center for Missing and Exploited Children. We've had that in place since 2003, although I wish we had an automatic way of doing that like you have in Florida. That would be awesome to have that. We still do that manually. So part of what we had to do is we had to first define what missing child is. And I think that a lot of states define that differently. Is that missing an hour, 2 hours, 4 hours? And with us, again, it's immediately. So we defined that, and we wrote procedures and protocols around what's expected of caregivers and caseworkers when a kid is missing, when a child from care is missing. So we have reporting requirements. We also have location efforts. What are they doing to locate that child? My interaction with sex trafficking and human trafficking came from missing kids. Almost every single youth in care who has been a victim of trafficking has been missing from care when it happens. So that's always kind of been my connection to this work. Oftentimes youth missing from care run to family or to support system outside of DCFS where they're not allowed to live for one reason or another. So I think sometimes if we find out why kids are missing and where they're going, one of the things Illinois has done recently is now kids can be placed with fictive kin, so it doesn't have to be a relative or a licensed foster home. If there's a place where they're going that we can deem appropriate, maybe that's where we can put them and they'll stop running away or going missing from care. So that was really important from us. So before you can start gathering data, you've got to define what it is, you've got to train your staff, you've got to write good procedures and protocols and then train the staff on that so they know what to report. The other kind of challenging thing for us, and I think most states use either SACWIS or something like SACWIS, the State Automated Child Welfare Information System. So we had to build mechanisms in our computer system for staff to enter information to actually gather that data. And that can sometimes, especially for a social worker, not a technology person, that can be very challenging. But we got that built in so we can report that data. So regarding missing kids, we obviously have information about demographics, what genders, ages, races, where do they go missing from, not only geographically, but as Sue mentioned earlier, like is there a certain residential facility or a group home where kids go missing, and is there an issue there that maybe we need to address because of that or work with law enforcement in that community? Regional information about like caseworker compliance. Are caseworkers doing what they're required to do to report a kid, look for a child, and then also, like Sue, on the tail end of it, when they come back, we have to do all that in reverse, report them located, and we also have a debriefing interview that we do with the child to find out where'd you go, why did you run, was sex trafficking an issue, was that something that they got involved in or victimized by while they were out there? So we can gather that information as well and use that to kind of inform our practice and our policies. With regards to identifying trafficked youth in care, that's been very difficult for us. Unfortunately, children don't step up and raise their hand and say, I've been a victim of sex trafficking, can you help me out? So kids typically don't disclose, so there are often times where we see a lot of the signs, we really think that it's happened, but we just can't prove it. So it's been difficult to train staff on that and when to make that call that I don't have definitive proof, but I really in my gut feel that this happened. So I see that as one of the challenges with collecting data on trafficked youth is just simply being able to identify them as such. So again, with trafficked children, we had to write procedures and do training. Staff had to understand what the risk factors were, like you had talked about earlier, also what the signs are and indicators. Obviously, if police call us and say we recovered one of your children, they've been advertised online, they were in a hotel, that's a pretty good confirmation, but we don't get that all the time or a lot of the time. So they have to understand what they're looking for to be able to report the data back to us. One of the things that we're starting to focus on at the department, which Colleen talked about, was predictive information. We are a reactive agency in general. We respond to child abuse and neglect. I think we have an opportunity to be proactive in terms of sex trafficking of our youth, especially youth in care. And what we've seen are certainly children who have a history of being missing from placement. I kind of don't like to say on run because we've had children who walked out the door and got coerced into a cab with a cab driver. They didn't leave thinking they were going on run. So certainly that is one of the factors. I haven't had a lot of children who've been trafficked for whom their last placement was a foster home. It's usually a facility. It's a residential facility, a group home, or a shelter, so another risk factor. History of sex abuse is huge. That's another thing. And one of the things we can't really figure out how to pull out of our system is I see a lot of lack of connection to family or support outside of the system. Kids who don't have any place else to go to look for that love and attention that they're looking for when they get into sex trafficking sometimes or become victimized. So those are some of the predictive things that we're starting to look at. And then once you predict and you see these kids are at risk, what are you going to do about it? What are you going to do to stop this from happening? So we've started with putting a small little prevention kind of a talk. It's curriculum that our residentials and group homes are doing with our youth in care to kind of inform them about the dangers. He might say that he loves you, but that's not really what this is. Or it's not normal to have a 30-year-old boyfriend when you're 12 or 13. That kind of a small talk. And then we're looking at a larger preventative curriculum to start using with our youth. I want to stop it before it happens more than anything. We need to all work ourselves out of a job, right? That's what I would like to see happen, at least for me. And with regards to data, I mean, we always talk about the big picture. I don't ever want to lose sight of individual. I learn more from individual cases than I do any spreadsheet any day of the week. And when I train our staff, I don't show data and stats on the screen. I talk about Victoria and Lauren and Chelsea and kids that I know about who have been trafficked. And I think that not only teaches staff about it, but it informs our practice. You know, where did they come from? How did it happen? What interventions have worked for these youth? We have one residential facility that didn't set out to provide care to trafficked youth, but I kept seeing kids that were missing that were placed there that actually stayed. Okay, what's the deal here? Why are they staying? And they've actually kind of built a program up around sex trafficking just based on working case by case, and we've learned a lot that way as well. One other thing I didn't mention that I know Sue mentioned, in 2010 we had our Safe Harbor Act passed in Illinois, the Illinois Safe Children's Act. That required law enforcement, instead of locking children up and arresting them for prostitution, it forced them to call the Child Abuse and Neglect Hotline in Illinois. So we had to develop 2 allegations of child abuse and neglect: human trafficking by abuse and human trafficking by neglect. So we also have data for that, children who are in the community. And as we were discussing earlier, a lot of those investigations are children in the community. They're not youth in care that we get those sex trafficking reports on. So that's another area where we're starting to get that data to inform us what communities is this prevalent in. I think it's important too, we looked at who is reporting that to us, and we were seeing a lot of mandated reporters that weren't calling us. So that ended up into a media campaign, a poster and a brochure that we've done to get word out to our mandated reporters that this is an allegation of child abuse and neglect that you need to report. So those are just some of the ways that we've used data in Illinois to inform our practice, and I think we're still learning from it, you know, today, and we'll continue to learn from it.
LATECIA responds.
That's great, Stacy. I think one of the key issues that you discussed is really the need beyond aggregate data is being able to hone in on the user and understand the story, and the qualitative data is just as important as the quantitative data. Very critical.
Melissa.
I always love the combination of having aggregate statistics, being able to show the trends, being able to show the breakdown across counties or regions, and then bringing in those stories. So that you're connecting the data to the practice in that way. I think that's very, very informative. Now, I have a question before we move to audience questions. Did you mention the change in outcome for the numbers of youth missing from care? I don't recall which of you were talking about the decline you've seen.
Stacy.
Well, for us, in 2003, when we started our response to missing kids, we had 1,000 youth missing from care, and today we have usually 175 to 200 or less. So putting that formalized response in there, I hate to use this word, but everybody always says holding feet to the fire, you know, ensuring that caseworkers and everyone do what they're supposed to do to report children missing and locate them really made a big difference in our outcome.
And for the data analysts out there that are wondering about the change in the foster care population, you did see an actual decline in the rate of youth who were absent or missing from care,
Yes,
in addition to that drop in overall numbers.
Absolutely.
Yeah, I wanted to add to that.
Sue.
Florida, too, in 2003, we averaged 1.5% of kids in care, while today it's like less than 6%. 0.6%, I'm sorry. Less than 0.6%.
LATECIA.
The fact that you're able to compare the populations is very critical.
Right.
In looking at prevention efforts, outreach efforts, et cetera. So I think that's amazing that you all are able to tout that.
Now we do have a few minutes at the end of our session for audience questions. So reminder to those of you out there, hopefully there are lots of you out there listening, you can type your questions into the chat box. And it looks like we are seeing a couple of questions come through. And the first question I'll read is, how do you handle runaways when they're only gone for a short period of time, such as 6, 12, 24 hours, for conducting screening about possible exploitation without over-screening youth? And I will open that up to anyone who wants to either talk about the reporting of children missing for a short period of time and the over-screening piece of that question.
Sue responds.
So they're asking, so a child that goes for a short period of time and maybe have been exploited, and then how do you, for conducting screening about possible exploitation without over-screening the youth? Well, I think when you're screening a child, it has to be a conversation. You know, you want the child to lead the conversation. I mean, you want to initiate the conversation, but hopefully the child just follows through and starts making a conversation, so that way they don't feel like they're being over-screened, that you're not actually, going down a checklist, did this happen, did this happen, did that happen. You want it to be a conversation and just, use some motivational interviewing, hopefully. For a short period of times, we handle them the same way. I don't know about you, Stacy.
Yeah, we don't make any difference on how long they were gone. And there's a lot of people that think, well, a child, every time he goes missing, he's only gone an hour. Well, you know what? You don't know that when he walks out the door. So you still need to do all the reporting requirements that you would do even if they have a history of only being gone for a short period of time. And with regard to over-screening, we don't have an assessment tool, a written tool, a checkbox that we go through at DCFS. The way we wrote our procedures and trained is to have a conversation with the child. So it doesn't feel like they're being screened or assessed. You're simply talking to them, hey, what went on? Where'd you go? You know what I mean? More of a conversation than actually sitting with checkboxes, because I think that could be seen as over-screening.
COLLEEN responds.
Well, similarly in Rhode Island, same thing. Once a youth has been returned from being absent from care, it's much more of an engagement. That team that I mentioned, our special projects unit, will actually try to really engage the youth and try to obtain some information to see if they have been victimized. They do have a screening, however, they really have had that being engaging. So it's not that they're sitting there with the instrument and screening, but rather when they walk away, they have some of those answers. So then we can put that in and we track some of that data, because that can help us when we're doing some of our predictive analysis to say how is that information kind of really helping to focus in on the risk factors. So it isn't a conversation, it's engagement, but then they walk away and they do kind of, yeah.
Melissa.
Because we did talk about the importance of having uniform and consistent definitions and data collection, and so you want to make sure that you have a tool where the worker or the staff person knows what data they need to be collecting, but as you've all said, it's clearly about having an engaging clinical conversation.
I wanted to add here, because I didn't get to mention it earlier.
Sue.
We actually have a human trafficking screening tool now in Florida, and it's statewide, and the Department of Juvenile Justice uses the same tool. And we also, in our training, stress to make it a conversation, don't make it a checkbox. We don't have an electronic database yet. DJJ, our Department of Juvenile Justice, does. So they can pull a lot of data from that, because when the worker goes back and fills it out, it is a checkbox. So, if you can, so everyone will have the same type of answer, so you can pull the data from it. So that makes it convenient for data collection. But definitely when you're speaking to the child, it should be a conversation. In addition to that, I just wanted to point out for our investigators, when we did the pilot, before we rolled it out statewide, we chose areas that had very low verification rates for human trafficking reports that came into the hotline. So statewide, the average verification rate for any reports is around 22% of verified reports of all the reports that come into the hotline. We had a couple areas that had 6% verification rate on human trafficking and 12%, so really low. So we piloted that screening tool there because, again, as Stacey was saying, it's all about training, what the caseworker or the investigator understands and recognizes the signs, and the child doesn't say, yes, I am a victim, mark me, I'm a victim. No, they don't say that. So you have to put all the pictures and pieces together. So one of those areas went from 12% to 30% verification rate after the pilot, and the other area went up to 22%. So it was just, it helped them see and learn, what's the
And by
actual indicators
verification
are.
rate, do you mean it was indicated as?
It was indicated as verified.
Gotcha, okay.
So we have 3 rates. We have no indicators, not substantiated, which means something's going on but not enough to verify it, and then verified.
LATECIA.
Well, one of the efforts that is ongoing currently at the Department of Health and Human Services is the Children's Bureau, along with several aspects in ACF, are working to develop a screening tool. It was informed by many of the efforts in the states, and it's currently being piloted, and we will be looking for that information very soon. But I also wanted to point back to another initiative in OTIP around the SOAR, Stop, Observe, Ask, and Respond. And that is designed to educate not only clinicians and health professionals, but the larger community, mental health, substance abuse, public health professionals, all these entities that will really provide the continuum of care for human trafficking victims. And that initiative is ongoing in our office and about to launch in September.
Melissa responds.
I noticed a question from the audience that I would say is for you, LATECIA. Are the core data from OTIP going to be disseminated to states?
Absolutely. The core data is actually going to we have a couple of key critical activities that must occur. The first being that we have to have clearance for the reporting and the data collection. Very important, but again, as we talked about, I mentioned the pilot earlier, we're working with the Children's Bureau specifically to test the feasibility of those core data elements. A lot of times we think that because it's been vetted, and of course we've been utilizing many frameworks like social determinants of health and Healthy People 2020 when it's applicable, although there's a need for us to provide human trafficking performance measures, but really leveraging the work that the Assistant Secretary for Planning and Evaluation did, a compendium back in 2007. That's a body of work that's guiding the work of HHS services to trafficking victims. That important work is where we began to leverage many of the performance and the data collection tools, the core data set. In addition to many of, when we're looking at interoperability, we wanted to make certain that we know what our partners in DOJ and DHS are doing, how these can be a core data set that we can begin to really set the stage for interoperability. As we are doing these pilots, though, we will be posting this information so that people can have an opportunity to begin to learn what issues or challenges that they may be seeing in adopting those measures, because we know that the fields may not be one size fit all, And we know that already from the various missions just among the federal agencies that there's a lot of work to do to really refine and make certain that we're all on the same page and alignment. The definitions have to occur. So yes, the core data from OTIP is going to be disseminated through the states, and we'll be working closely with the Children's Bureau to develop an information memorandum as well as technical assistance and training materials to support that work.
I love it when we can say yes to questions like that. Yes, of course we are. So I know we have a few minutes left, and I wondered, we spoke about partnerships early on in the conversation, and you just mentioned interoperability. And I wondered if any of our panelists could speak to the importance of relationships with community partners and to data sharing. Any of you have, or could you describe briefly, your data sharing agreements or data sharing partnerships with law enforcement, juvenile justice, or service providers, and how that is informing the work that you do, whether it's maybe current or planned work?
Stacy responds.
I think you have a lot more of that going on than we probably do, Sue, to be honest with you.
Well, with law enforcement, we have a more open sharing, especially if they have any criminal cases open, then we can share almost anything with them. Other ones, we can share information, numbers, statistics, and we do share that. We have a lot of task forces that are trying to apply for grants. We have a couple of data collection projects going on in Florida that I know about. One is in Southwest Florida, and one is actually in Orlando area, where they're trying to collect data from all the different service providers to be able to apply for grants, to have numbers, to have something to base their grant applications on. But we definitely think collaboration is really important, and working together and keeping these kids safe. It's not one person's job. We have to work together. We do work together with Homeland Security, with the FBI, with our local law enforcement, with our service providers, with our community-based care agencies, which are our foster care service providers, and the department, and trying to do whatever we can to help protect these kids. And I think we're really lucky because in a lot of areas we have some really good partners who have the same focus that we have, all child-centered focus to help.
Colleen responds.
I mean, in Rhode Island, we have a really good collaboration as well, led by, as I mentioned, our Special Projects Unit program manager. And there's been a lot of work that has been done by community providers that provide services to the youth, also law enforcement. And so there's been a lot of collaboration that has been going on for a number of years. And because understanding that that information that needs to be shared, not everyone has all of the information. So, there's some maybe health information that's not going to be necessarily contained within the Child Welfare Agency. And then there's some legal information that's not going to be. So having this task force and be able to share some information can really help. And, Rhode Island being small, it's great because our task force can meet in person as frequently as possible because it's never a far drive. So that's good.
Thank you so much, and thank you all for joining us today. I hope this has been a helpful and informative session.
Melissa describes day of operations that are no longer available.
As you exit the session, please be sure to participate in our evaluation. And following the evaluation, you'll have access to the exhibit hall and an opportunity to participate in a virtual chat session with our panelists in both in the State Spotlight on Sex Trafficking exhibit booth, which has representatives from Florida and as well as Connecticut's Department of Children and Families, and the West Coast Children's Clinic. And you'll also be able to interact with our session panelists in the networking lounge section of your screen. And during that time, you can visit other exhibit booths as well and download some of the resources that have been mentioned during this discussion. The next session, The Heart of the Matter, Collaborating to Improve Permanency Outcomes for Youth, will start at 2 p.m. Eastern Time. Thank you.
To search for Child Welfare Virtual Expo activity on Twitter, use #CWVE. The Virtual Expo is presented by the Children's Bureau and the Capacity Building Center for States.